Hey y'all, welcome to Vetted and Vet Med, the podcast where two African American female veterinarians pull back the curtain on the life and the world of veterinary medicine. I'm Dr. Wilson.
And I'm Dr. Levy. Join us as we dive into real conversations about mental health, career transitions, work-life balance, and the unique experiences we face as Black women in veterinary medicine.
So go ahead, grab your stethoscope,
and get your favorite cup of coffee or wine, and let's get vetted in vet med. Okay. So we're back from a few weeks ago. And we just been trying to get through the month of April, and we finally made it. And we are now in May, and we're looking forward to the flowers that May is supposed to be bringing us.
Yeah, because like I told you, April showers bring May flowers.
Yes.
Me.
Yes. This is Ayana's birthday month. So the whole month. We celebrating Ayana. And this is actually one of the busier months for me because almost everyone in my house also was born in the month of May. So they are indeed, yes. So yeah, this is when I am really busted my butt picking up extra shifts to afford to get through the month of May.
Oh, that's funny.
Because Darren is the 14th, Davis is the 11th, and then Daryl is the 11th or the 14th?
14th.
The 14th, yeah. Yeah, Darren, yeah. So, yeah.
Great people.
Then you have Mother's Day. Mother's Day is right before that. Then Daryl's is the
150K. Anybody listen?
Yes. We're gonna add your you got Cash App?
Yeah, I'm putting my Cash App up there. I know they won't let you give a certain amount, so just keep giving in the increment.
Yeah.
I'll take it.
Oh Lord. And then Daryl, he ends it he's the 29th. So it's a lot. Then I want to we want to send a shout out to our first and only subscriber. Our monetary subscriber, who happens to be Ayana's lifelong best friend.
Bestie.
Lauren O, because we're not giving our full government names. We're just going to say Lauren H. O.
Not to be confused with her.
Exactly. That's why I didn't say it like that. Yeah. But thank you.
That is very supportive. I appreciate you wholeheartedly.
Yes. We do appreciate you. I was so excited when I saw that. I said, oh, we got a subscriber. So anybody can subscribe and get a shout out by visiting vettedandvetmed.buzzsprout.com. That's where you can go to listen to all of our episodes. It has our show notes on there. And then also a way to help support us is subscribing, if any amount, but they have designated preset amounts on there as little as $3. Up to $10 monthly subscription, which does help to allow us to continue providing these services. Thank you again, Lauren, and we look forward to the next subscriber. Yeah. And if y'all, want to continue to see what we look like, you can also go to YouTube because we do have videos of ourselves. And we cute, and we would like to see more subscribers on our YouTube channel.
Subscribe, press the button. It's just a button.
Like,
just a button.
follow.
It's just a button.
Yeah, it's just a button. Download, share. So we need y'all support. But we are continuing the series of Diary of a Corporate Black Woman. So we're still talking about our experience in corporate veterinary medicine. And the last time I remember ending on talking about the amount of patients that are on the schedule as a norm. Upwards of, 30. I think the most I've ever personally had on mine was maybe like 33 pets. But I know I don't know if I've seen more than that on somebody's schedule. But that's the most I've ever had. I remember one time the first corporate clinic that I was working in, there was a relief vet that came, and I don't know if he just had not experienced that before, but one of his remarks leaving was, "What is this, McDonald fast food type of clinic?" Like that's what he compared that clinic to, was like McDonald's or fast food restaurant, where essentially you just getting the pets in and out.
Busting them out. I feel like I've had, I mean, on a norm when we had good days before
Hmm.
this I won't say the surge because it's really not a surge, it's um a depletion of people coming in to these particular clinics that I had been working at. But um I would say it was probably, high 20s, but we also used to do certain days that you would purposely put a bunch of pets on the books.
Hmm.
And it would be, you get your strongest people to do certain things or what they're really good at. And that's how the flow is. And, it was exciting and new and all this stuff until it wasn't.
Hmm. Hmm.
Because in the grand scheme of things, honestly, I'm sitting here having a realization right now is like vaccines are one thing, but you even still rushing through, even though I like to give thorough examinations all the time, rushing through it's just not good in any shape or form.
Hmm. Hmm.
You get all this praise for doing, 40 something patients in a day, but then you turn around and then you miss something, or you couldn't have a
Exactly.
conversation about this ear infection.
Yeah.
At the end, it's not worth it. So,
Yeah. I think it's right. It's easier to miss things. It's easier to end up making mistakes because at some point you have to start delegating things
mhm.
to, your assistants or your technicians. And for me, it's hard to do because experienced so much. Because the next thing you're tasking even something as simple as vaccinating, and then
Mhm.
somebody comes back and they're like, "Oh, he wasn't actually due for that."
Yep,
Um,
they get one meal of um Pro Heart instead of 0.15 or something. You like,
right.
okay, dang.
And granted, any of those mistakes can happen anytime, but
Yeah.
right, to anybody. And it's just the oversight. Like you're trying to oversee so many things. And at some point, it's like you haven't seen that, like you try to go back to look at the previous like history or vaccines that they've received in the past, any alerts that they have. But when it's, back to back, I'm like, it it's hard, yeah, to even keep up with doing all of those things. And so I
Oh, yeah.
know,
Go
hmm
ahead. No, no, I'm sorry.
yeah,
Go ahead. Go ahead.
yeah. And I mean, and that's when things happen. And at the end of the day, even though you may have trusted somebody to, do things on your behalf, it always comes back to you.
Because you're the
Um,
doctor.
yeah, you're
It's
the
your
doctor.
responsibility.
Exactly, exactly. Even like I mentioned before, I was talking about having time to do notes.
Mm-hmm.
So that's always the thing that has kept me behind, and even staying after is because you're trying to keep up with the pace of all the patients going in one room after the next. And then it gets down to the point where you've seen 10 pets and, none of the notes are complete. And then it's just like, okay, I need a break because even though there's no designated time for you to catch up on the schedule, like at some point you just have to break away. Like, I need
Yeah,
a
give it that
break.
time. Yeah.
Yeah.
No, I hear you. I remember my chief of staff when I first started. He told me like how important notes were because one time his notes got summoned rather to court for a divorce proceeding, and
Mhm.
he was like, "Oh, I am so glad that my stuff was in the way that it was supposed to be in because I mean, of course,
Mhm.
nobody knows what happened, who got the dog, who didn't get the dog, who knows,
Right.
but." His stuff looked good.
Mhm.
That was his concern to make sure that that was complete and all the things. Um, and I was just gonna say, as far as like the volume in which they expect you to see certain things, I can recall just going one time.
Mhm.
And I we were doing dentals and I started taking out this dog's catheter and I'm just like and the nurse is just looking at me and I'm like, what? And she was like, what happened? And I'm like, I don't know. Like, what are we talking about? And she's like, I said, we didn't do a dinner on this
Did
dog
the
yet.
dental?
She was like, no. I was like, why did you stop me? I said, girl, I am like in my own head just trying to get
Yeah.
something done. And perfectly good catheter, gone.
Gone.
And I'm sure something else happened that day. And that was in that moment. And at that time in my life, I was just like, um, I think we are getting to the end of things because as little as that is, that could
Yeah.
have been anything. That could have been any mistake. That could have been any situation. And I'm out here taking a catheter out of a dog that hadn't even got a dental yet. Like,
Mhm.
and in theory, it's just the idea is I wasn't paying attention. I wasn't
Yeah.
on the end. I wasn't there. I wasn't, focused. That focus could have been in a number of situations. So,
Right.
yeah, I don't like that.
Yeah. Well, I started off at the initial corporate clinic that I was at, and then after I left, I had gone off to do my own mobile clinic and went back doing relief and lab animal. And so, I actually was having a good time. I was enjoying that time, and I felt like I had like the best of both worlds at that
Yeah.
time. And you got to be careful when you do this relief because people just try to snatch you up.
And
And if you don't want to be snatched up, it's additional pressure. I'm like,
yeah,
I'm just coming here to do my job,
right.
and leave.
I'm helping.
I'm just here to help. I'm not trying to join a team. And I had been like that for a while, especially because of the experience I had where I had, left what I knew to throw myself into small animal and then I had so much hope and to not receive that, I didn't really want to go back to being a part of a team at the time. And so I was happy being free. And then again, my best friend, well, now I'm about to shout her out because she was the one. When I was at the first one, she was at that same corporation and she was like, "It's amazing. You should come." And I went. And then she was then at a different corporation and she was like, "It's so great. You should come." And granted, we at this point we weren't even living in the same state. So it could have been different. Eventually, it showed its true colors where she was at as well. So she did not last that long. So, but my
Just kidding, just kidding. It's not. It ain't it. It ain't it. Abort mission. Abort mission.
but it was too late. So yes. So I have several best friends, but I would say my BFF is Sherelle. And so yes. So that Dr. Sherelle Milligan. Um
Sorry.
uh,
Sorry. You too. Hey, girl.
So, and it's funny because this same corporation, I remember when I was applying, I finished my residency and I was applying for different jobs and um specifically in lab animal, but it really wasn't a lot of options at that time. And so I started applying. I applied to this same corporation and I got on and was in training and literally for 2 weeks. Because then the place that I really wanted to work at in Lab Animal called and offered me the position and girl, I was out of there.
You said, "Oops, I gotta
I
go."
was gone.
Was waiting on that one. Yeah. Sorry,
Well,
girls.
and like, I mean, as an adult, you just have to make the best financial decisions that you need to make for yourself. I'm like, what am I gonna do? Not work? Not, So I'm like, I have to work. And so I didn't know what was going to become of that position. Yes, I was interviewing or whatnot, but I didn't know what was going to happen with that. So I had to start working somewhere.
That's
So
right.
anyways, so I got up on out of them and just was like, I'm never looking back.
Nope.
However,
You looked back to the
look
little spot.
like Lot's wife, I looked back. They said, don't look back.
Oh, you pee. You use your peripheral, and you were like, and
Lord, and I haven't quite turned into sand, but it definitely felt, felt like it. So yes. She was at that corporation again in a different state and the incentives. Um, like I said, I was happy. I was happy with what I was doing. But when she talked about the incentives, I said, I was like, are you serious?
yeah, yeah.
The amount that she was getting for her productions, the amount of like the sign-on bonus that she received. And of course, I told Daryl, and he was like, "See, I could never be a vet because he talking about he would just start one job, finish the
Well, girl,
time."
you have to commit. You have to commit for at least 3 years, I'm sure, or you got to pay them their money back. They want their coins.
Exactly, they want their coins.
Yes, but the girls do have incentives.
Yes,
They know how to rope the
yes.
two in.
He's talking about
Yeah,
I'll just be hopping all over the place. I'm like, I'm
I
sure
wish.
there's people that do that, but I mean, I don't know. It's probably easier for men to get through some of the foolishness that we have to get through. I don't know. Like I just get tired, and I'm like, I don't want to deal with this no more. I don't want to deal with these people. I don't want to deal with the structure of things. So, anyways. And she's in a different state. She's in South Carolina. Me,
Mhm.
I'm in Texas. So the incentives are, the market and the things, the money is different here.
That's different.
So I said, you know what? I'm just about to bite this bullet and it's just gonna be temporary and I'm gonna sell my soul for this temporary period. And I'm gonna
Baby,
get it
I
back.
was not lying.
I'm gonna get it back. And I mean, I negotiated. I started off at 3 days because that was all I could really do.
Yeah.
So I'm like, I'll do 3 days a week. And that sign-on bonus was substantial. Um, I don't even know if I'm ready to actually give out. I would tell you, but to the world, I don't know that I'm ready to give out those numbers, but it was substantial.
Let's
And
just
they'll show.
say it's good. It's really good.
Mm-hmm.
I think some people would not believe the
Mm-hmm.
amount of money
Mm-hmm.
that they are paying for people to join their team
Mm-hmm.
and like
Mm-hmm.
sell your soul. And honey, if that's what my soul is worth for a couple of years, if you being temporary, we might talk about it. Yeah.
Oh man. And the potential for the production is there depending on where you're at. So the hospital I initially started off at, I wanted to go to one that was closer to home, but there was no availability at the time. So I went somewhere a little further, and the potential for production was not there. It
Mm.
was not there. It was a hospital that was struggling. And I came. So they just, my boss at the time, she pretty much agreed to everything that I asked for because of that, because the hospital was not doing well financially. Of course, I didn't know that until I got there. I'm like, this is why she just said yes to everything. Um,
Yeah, girl. Yeah, yeah. I'm like,
Because I was even negotiating the time that I came in. Because from my experiences, I was like, you know what? I don't want to have to be at work for 8 o'clock. I want to come in at 9.
let's be honest. Your girl never saw 8 o'clock, honey. If I had an 8 o'clock meeting, I was on
Mm-hmm.
call, but I was not at work at 8 o'clock. I
Mm-hmm.
was working. So
Yeah.
yeah, clock me in, sis. But no. For what?
No.
What we doing?
I just, I had got to a point even at that time where I wanted to not have my mornings be as stressful. I hate rushing and
Yeah.
the frazzledness of the morning. So if I can get to work by 9, then that means that, I've already woken up, had my time, gotten the kids together, taken them to school, and then I can peacefully
Yeah.
drive into work, like I'm not flying down, even though I'm probably still flying anyway, but I just drive fast. But I'm not like just rushing, trying to get somewhere, and I feel like that just kind of sets the tone for the day. So that I'm like, I can't come in no earlier than 9 o'clock. So now I'm at this new job at this location that's further away from home, and it was slower even there too. I would maybe see like 10 to 15 pets. It was not a lot at all, but what would happen would be that most of the pets would be sick. And even though it was not a lot of patients on the schedule most days, we had a skeleton crew because there were always call outs. Always. So first of all, let me backtrack. When I started, I had done a few relief shifts with the corp. I had done quite a few relief shifts with the corporation itself. And then this particular location, I did a couple before I was like, okay, I'm okay with going ahead and joining this team. So I would recommend that for anybody that is even considering starting anywhere,
Yeah.
to maybe work a couple of shifts there first. But it was good enough from what I saw where I was just like, okay, sure. I'm fine. Cause again, it's not all about the money for me, but knowing that I was getting that incentive, I'm like, sure,
The incentive.
I can work here. Sure. So when I started, the technicians, nobody knew that I had actually started working there. Only the practice manager. And so that was not communicated with them. They thought I was still relieving. So when I started, like, I don't know. I don't need grand gestures, but
Yeah.
like you see things that are done for other people. And so in the back of your mind, you want to think that, this is standard, like
Like give me like a gift bag. Welcome.
something. Because at my first one, they did do that. They decorated my little
Yeah.
desk area and everything and was like, welcome, and got me little gifts. Even one of my relief chefs,
Desk.
they've done that, like giving, wrote a card, like, thank you for coming to help us out. Like a relief chef gave me a little tumbler, some snacks. Yeah.
Never had a desk.
Yeah, mine was not a desk. It was an exam room
Oh, okay.
that,
I was like,
yeah,
never
this,
had one of
well,
those.
yeah, that first one, it was like, it was shared space, but if I was there, it was my space.
Okay. Okay.
But at this second one, there was no, it was an exam room that I pretty much took over as if it was my office. So
Oh,
again, when I wasn't there, they would use that as, they would use it as normal. But when I was there, like there's
that's good.
three other exam rooms that you can use. We're not that busy. Use those.
Move along.
So
Move around.
so that was my office. But there was nothing there. I mean, I barely went through any real like training. I had to figure out, how to work the software, which I had used during my relief shift, so I knew how to use the software, but
Right.
it was minimal training. And so then I had to be the one to like tell people along the way, like, yeah, I'm working here now. I'm one of the new, I'm the new vet here. And so they didn't even know. Because one would think that you would brief your, whole team that you have a new doctor starting.
I mean, but that kind of plays into the culture piece, right? So, what conversations are you having if you're not even having a conversation that you have an actual doctor starting here? You're not talking to your team about other things. That's a pretty big piece.
Mm-hmm.
So those other little pieces are being neglected as well. Like they're not
Mm-hmm.
conversations, not having any conversations about anything.
Mm-hmm.
It makes sense. It tracks for sure.
Mm-hmm.
Yeah.
So, anyways, started working, and then I realized very quickly that, we had a skeleton crew, one, and then secondly, that even the people that were there, they were burnt out. They were over it, they were done. And I have never worked at a place that had so many call outs. Like literally, Ayana, literally on a daily basis. At least when I know when I was going in and you on the group chats, there was
Mhm.
a call out every single day from somebody, or they went home early because they weren't feeling well
Yeah.
every day. I'm like, this is ridiculous. And for
Which
you to
I think.
still have a job, yeah, for you to still
Yeah.
have a job. But I
Yeah.
had never experienced that in anywhere that I've worked. And so I knew like these people they are not happy. They don't want to be here. So it just kind of set, me coming in new, it just kind of sets the tone for how the culture of this particular location. But again, that location was struggling. Even like I said, even though it did not have a lot of patients on the schedule, it would take us so long to get through. If you only had 10 pets on there, why does it take the whole day? And all we did was drop offs. There was some appointments in the afternoon, but most of those appointments were from drop-offs, and it would just take the entire day because somebody would always have to step outside to take a break. Somebody had to go to the bathroom. Then, because it was skeleton, you're doing something, working, you trying to have a flow in the back, but then now they have to go up to the front to do,
Right.
check-in.
I just want to see the dog. Can I see the dog? Can I see the pet on the table? That's all I want. That's it. I
Oh
hear.
my gosh. So it just dragged and dragged. And I think I was there for at least a year, a little over a year. And then I finally was able to go to the location I wanted to go to initially that was much closer to home. And so I worked a couple of, kind of did a transition. And I loved that team. It was like a breath of fresh air
Yeah.
when I got there.
Oh, okay. This is why I signed up.
Yeah, and I wish, I don't know if things would have been different if I would have started there from the get-go, but you also start to wonder like, okay, why did those other people leave? You wonder why there was now an opening for you when it was a 4 to 5 doctor practice. And
Yeah,
now
that's why.
yeah. So, and there was one full-time, two part-time. One left for health conditions, and the other, I think left to like go do their own thing. And then the one of the part-times eventually left to do their own thing. So then it ended up being three of us, which myself and the other one was part-time, and then we had a full-time. And it was funny because the full-time vet, I remembered her from when I was there those 2 weeks,
Mhm.
all those years ago. That was a full circle moment for me. She was
Hey, girl.
also, I
Hey, how are you?
don't even know if she had remembered me, but I don't forget, I don't forget her face. And so I'm like, what do I know this girl from? And then I'm like, she was in training, finishing up her training when I had just started my training back in like 2016.
Mm,
And so I was like, dang, she been here. She was here all this time. She was here.
all along. She's been here all along. Okay. All right. Let's see.
So I thought that was interesting. But we had a good I had a good relationship with pretty much everybody that was there, but along the way, you start to see things about people, and then you see the culture of the clinic as well. And then I realized, oh, this is a high volume location.
Mhm.
And that location was always known to do very well. But I don't really know that I knew what I was getting myself into when I transferred to that location. So I went from seeing the 10 to 14 pets on the schedule to seeing, in the 20s now. And at this location, it was some of the practices were different.
Mhm.
I was never briefed on any of the way that they practice. It was just I would do something, my way or the way it had been done at the other location. And then I would see like an email from the practice manager, generalized email. I was never communicated with a lot of things directly.
Not the passive aggressive email.
So like you just would have to like be like, is that about me?
Yeah.
And not really know for sure.
Hey,
One of the
hey, girl, let's talk.
Is it
Let's go.
about me? Is it
Let's
me?
go in my office.
My
Let me go to
office.
exam room 3. Come on, let's go.
I remember one of the things was the parking. No one ever told me where I was supposed to park. I would I never parked in the front. Obviously, I'm gonna save those for clients, but I would park on the side because this was a standalone. So I would park on the side. And I don't even know to this day if even that one was about me, but one of the CSCs had sent an email in regards to where to park. And you're not supposed to park over there with a whole map outlined of where you're supposed to park. So
Not the diagram.
a diagram highlighted. This is where you park. And I'm like, nobody. If they would have briefed me on these things, I'm okay with following directions, But
You got to give direction and follow it.
right. And I remember one time because the technicians and the CSCs, they did like to bring in their pets for me to do for whatever reason. And I remember when I first got there, one of the CSCs brought her pet in for a dental. So we did the dental cleaning, and she also had radiographs done. and they were sent off. But I don't even know that I remember the fact that her dog had the radiographs done, but also since I never received the report, it was not something that was on the forefront of my mind to know that I needed to go back to follow up with her. And so there it was months that went by. I never saw the report. It had been months. And then we get this email stating that when we have associates that bring their pets in, they need to be treated with the same quality and care as the rest of, any other patient that's there. And and basically talked about that there was a radiograph report that one of the techs just happened to see and realized that it was never discussed with the receptionist. And so I'm like, I didn't know if that was about me or not. I had to go back to no, and even still, no one told me. No one told me. So
I need my shades.
I had to go back, and I think I had to go back to the date that it was and realize that, yeah, that was one of my days. And then I saw who the employee was, and
Yeah.
I felt terrible. I felt terrible. So what had happened was I was not, since I was still linked to receiving the reports from my previous location, they were
Mm.
supposed to take me off of that list and add me to the list at the new location, and that was never done. So I was not receiving any emails in regards to any reports for that new location.
Oh, so it kind of sounds like they dropped the ball
They dropped the
and
ball.
then sent an email in a passive aggressive way to make you feel bad about something that you had no control over. Oh, okay.
Mm-hmm. Mm-hmm.
Let's start
And
following.
right. So when I brought it up, when I realized who it was, I got the report and I went and sat with the girl and talked to
Yeah.
her about the results for her pet. And obviously documented that, but then I had to go back and bring it up to the practice manager because I was like, I
Okay.
had no idea. I had no idea. And I wish that even if she didn't feel comfortable talking about it with me, she could have maybe brought it. I know the lead vet knew about it. And one of the techs even said that she saw the report, but didn't say anything. Like, no one even gave me the report to go over. Like, it was just so dumb. And I just went and I talked to the practice manager about it, and then that's when we realized that I wasn't receiving any of those emails for any reports. And so then we got that taken care of. But I'm like,
I
all you
hope
had
there.
to do.
I hope, but I know there wasn't. But I hope there was like even a slide in of like, I'm sorry about that. I didn't even realize that this wasn't done. Because when you have a lack of communication, the least you could do is have the formality of saying, I apologize. I'm sorry.
Hmm.
You were part of the shenanigans. And
Yeah.
not in that particular situation, you were out here sending emails to start.
Right. To
So,
start. I don't remember. I mean, she could have apologized. I don't even really remember. Um, but that was the beginning of those types of emails because there were several. That was just how she communicated. It was not direct, it was always indirect. And I was left to, and I'm not the only one that experienced that, but I was left to try to figure out, like, were they talking about me? And having to go back to try to figure it out. And in some of those other cases, it was about me, and I always was the one that would have to bring it up and address it.
why you playing
Always,
Clue at work?
girl. So that was stressful because that was kind of like even the beginning of anxiety associated with
Yeah.
going there because you're all it's like even like for me, I will say that I am a perfectionist. I'm like, so for me, it's hard, if I make a mistake, I really give myself a hard time. And I am hard on myself. And so it's almost like, and I know that I've suffered from like people pleasing and imposter syndrome. So, like, it's almost the fear of like somebody else identifying a possible mistake that you made is just like crushing,
Especially before you do, right?
Yes, and if they don't address it with me, because I've come to the point where if I make a mistake that I can accept it,
Mhm.
and I'll try to do better the next time. But for me, I'm walking around before an email is sent out. I'm walking around, I'm coming in, good morning, not knowing. And the way that I now know that they talk amongst each other, I know
Yeah.
that everybody already knows, something about something that I've done and I don't even know. So now, as I look back, I just think about multiple of those experiences. And I know that they used to talk about me.
Yeah, absolutely.
Because yeah, I'm like, you feel the energy, when people are off to the side having these conversations. And I had somebody tell me that, yes, they be in there talking about you and they talk about everybody. So I don't even take it personal. They just be in there talking about everybody.
Hmm.
So these are things that I just didn't see until, later down the line. Definitely not up front. But it kind of, tracks along with why people may have left.
And it serves culture problems,
Mhm.
culture.
Yeah.
Hostile work environment, because that definitely turns into a hostile work environment.
And nobody really cares as far as in leadership because the hospital number wise does really well.
Mm-hmm.
So
Can't be
it
that bad.
can't be that bad.
Yeah.
So,
Your little people talking about you. That's nothing. Look at these numbers
mhm.
performing tremendously,
Oh
but
my
at the same time,
goodness.
it's a
And
culture problem.
it's a culture problem. And like the emails or the text messages that you receive when you're not at work. Because again, I was part-time. So again, I started at 3 days. And when I transitioned to the newer location, I was like, I can't do 3 days no more. I can only do two.
Yeah.
And so I backed down to 2 days a week because it was just too stressful.
Yeah.
And so I was only doing the two. So the way that my schedule could line up, it could be close to about a week before I'm back there again the following week. And if you're sending me a text message or an email, I feel like some of the things do not need to be addressed by me. I'm not there,
Yeah.
and if it is something specific to me, leave me a message and I'll get to it when I get there. Um, because I had to put that distinction from work and home. And I understand in some positions that's nearly impossible to do because you have to be constantly answering, to somebody. But I really feel like that's important that some of these things it can wait because I would be anxious like if I know I'm not going to be back there for a few days and you're texting me about a pet, that something happened, or you send me a picture of a pet's wound that dehisced, and I did the mass removal.
Hmm.
And I'm not there till another few days. Like, what you want me to do? Because
I can come in and suture it right now. Absolutely.
I'm not doing
But
that. And if the
I'm
pet is
off.
cured, I'm
I'm
off.
off.
So why are you bringing that type of like it just makes me anxious
Yeah.
because now I'm thinking about, and then there was one time that happened. I was sent a picture of a pet's wound that dehisced with no context, no information. And, I was just replaying back everything and how, like, whether I made a mistake,
Yeah,
or something that
yeah.
I did wrong. And then once I went back in, it was due to the pet was jumping all around at home. And so it opened, and even subsequential times after that, it was a hard incision to manage because I believe it was a mast cell tumor as
Mhm.
well. So it was hard to even manage the pet. And I'm assuming, because I never saw the pet again, but I'm assuming that the incision closed at some point. But I know he was there at least two other times after that to
Mhm.
address that same incision. But again, with no context,
Just he was sending me pictures. See the baby.
I'm thinking like, okay, what did I do wrong? Because I remember too, that was my first time using the cautery that the electric cautery that they had there too. And I'm like, even more pressure. Like, did I do something wrong? No.
It. I just sometimes I always think about like I'm not confrontational, but I won't. I'll get in my head just like that. But you also gonna get in my head because we finna be in here fighting. Why you sending me this picture? Why?
Mm-hmm.
I need to know. Like I'm off. Who is this? What is it?
Mm-hmm.
Explain.
Mm-hmm.
Because when you're aggravating me and trying to incite something, I'm gonna do the same thing to you. We're gonna be in it together, boo. Because now you have really tried me. That's like one of my biggest pet peeves. Like
Yeah.
people tried me. So now we
Mm-hmm.
can try each other, and
Mm-hmm.
let's see who wins. Because this was absolutely just left, and of course this can happen at anything. It just,
Mm-hmm.
but I feel like I didn't get this. I didn't get this. Like
Mm-hmm.
the chit chatter after you leave and stuff. Like people gonna talk. That's what they.
Yeah.
But I hear you on this for sure. Like the nitpicking and the passive aggressiveness. Like I
Mm-hmm.
had to tell the doctor in a meeting that she was passive aggressive with me because they let stuff slide with her for so long, and eventually they ended. But like, yeah, I hate that you had that experience. Like people
Mm-hmm.
that type of anxiety in you by sending you pictures and emails and all that kind of stuff because it's just a different kind of petty. Like
Mm-hmm.
people
Mm-hmm.
have to be petty, but it's petty with a purpose. That right there,
Mm-hmm.
that's that's just nasty.
Yeah.
That's what the young people say. It's nasty work.
Yes. And then I remember just my schedule because it wasn't necessarily about the number of pets. Yes, it was a lot of pets, but the fact that we had to do surgeries, this can be anywhere from, I would say, maybe six to close to 10. And that's a mixture of dentals and the neuters.
Are you the
Um,
like are you the surgery doctor or do you have to see rooms after that?
so let's let me
Okay,
keep
okay, okay,
going.
okay.
Yeah.
I was
So
gonna say
I am the surgery doctor, but I also have drop-offs.
Mhm.
And in addition to that, we were also seeing rooms all in the morning, all at the same time. And that was not anything that I had experienced at the first location. It was strictly drop offs in the morning and whatever surgical procedures, and then the afternoon was reserved for catching up with whatever drop offs and then your room appointments. But at this one was they would try to load up the surgical procedures and it would be anywhere. I don't even want to exaggerate, like, I'm not exaggerating. There could be at least maybe 10 to 14 drop offs in addition to your surgeries. And then in the afternoon, and like I said, in the afternoons, obviously, yes, you would try to finish whatever drop off. Sometimes those surgeries led over into the afternoon, so you'd have to go back to finish those. And then you were seeing rooms. And at one point, I don't know if they always did this, but during my stay there, they opened up the rooms. So we were seeing rooms as well. And I just thought that was insane. So when I first found out that they were even talking about doing that, I spoke with the field director. So I'm like, I know that that person is in direct control of what everybody else is doing in this clinic. And that person told me that that was not, if that's not what I felt comfortable doing, then that would not happen.
Yeah.
And that was a lie because it definitely happened. And I voiced that I did not feel comfortable with that because I do not, granted, the technician is there, they would do a lot of the actual cleanings.
Yeah.
And so that's fine. However, I don't want to be off in a room if I have a patient back here on the table under anesthesia. At least if you're working through the drop-offs, you at least still back there,
Yeah.
you
But
know.
also, like, you can't control if you got a extraction, or
Mm-hmm.
what if this
Mm-hmm.
dog crashes under anesthesia? Like,
Exactly.
to your
So
room, go home, girl. I got lots of stuff to deal with back here. What?
so that right there, that was just insane. It was
Yeah, that sounds
insane.
chaotic on a different level.
Insane. And I'm like, I don't know. I just don't understand why anybody thought that that was okay. And I think eventually um they did away with that, but every now and then you'll still have the rooms that couldn't drop off. And so they would still have pets come back there. But that, and I talked to my boss about that as well, and just feeling overwhelmed. Um and so I remember one time I was kind of like at my ends, like I was about done, but I said, you know
Yeah.
what, let me not, I don't want to leave without having had these conversations because I put my notice in November, but I had already written my notice back in August. Like I had just wrote it out, just to get it off of me. But prior to that, I had already had, communications with the practice manager. We didn't have, like a like what your position was as like the area. We didn't have one of those. So we just had to leave it, which I mean, we had a good working relationship, but she was not someone that I felt comfortable with confiding in as far as my concerns. And so I did just kind of release all of my frustrations to the practice manager, and she promised that everything, would get better because it came down to the numbers for me and adjusting healthy pets versus sick pets, because that was the other thing. I would see so many sick pets. I'm like, the urgent care is across the street. There needs to be a limit.
That's not your girl, okay?
There needs to
Like,
be a limit on
I
how
am not the
many.
urgent doctor.
And we would see so many sick pets. I'm like, oh my gosh, the scheduling for me was terrible. It left no consideration for the doctor or anybody really working in the back with these pets because we're having back to back sick pets, double booking sick pets. And even the healthy ones, I'm like, I've talked about it endlessly, the communication that occurs with the receptionist and the owners, like what questions are being asked, because are the right questions being asked?
Yeah,
Because why are so many healthy pets coming in as sick?
yeah.
Like they
Yeah.
all got concerns, everybody.
Wait a minute. So you just not getting rabies? Huh? You just not getting Bordetella? Come on. You, yeah.
And
I,
initially, yeah, I'm like, initially, you feel that pressure to work all that in.
Uh-huh.
But then I got to a point where I'm just like, that has to get addressed. You're going to have to schedule a separate appointment for this additional concern because we don't have the bandwidth. We don't
It's
have the
fair because they
time.
expect you to do that in a certain time period. And
Yes.
it's not the same as a sick visit. So that's fair.
That I started moving to that, which I know that I don't know if if I was a fan favorite, for
That's
doing
frowned
that.
upon. You know
But
it's definitely frowned upon.
But I'm like, I'll at least put together an estimate for you. These are all the concerns. However, this is the most important thing. This is what you came here for today. This is what we can address today. You can schedule an appointment to come back or drop off. Because that's the other thing they like to do is, okay, well, you don't have time, just have them drop off. Everybody can't do that. And secondly, it's still another pet that I have to tend to, and I'm already overwhelmed with the current schedule that I have.
Yeah.
So it's just another one added.
Yeah. It's not really giving me more time per se. It's just this owner is just no longer in my face.
Right.
So
Exactly.
yeah. No,
But
you
I
were protecting your peace.
trying to protect my peace. And even when because they want to say, okay, well, how many sick pets you want to do? How many surgeries you want to do? And it's just like, I hate that. I hate it. I hate it. Because for one, it kind of makes you feel like, especially if there's another doctor there where they don't really have any preferences or whatever, they just take whatever. And I'm here trying to like advocate for what's possibly less than what they're doing. And so it kind of makes you feel a little like, I don't want to say maybe inferior, or like you're not as strong, as a clinician as they are because you're asking for less of a workload. And it's like, okay, well, it's not that I can't do this amount, I'm like, I can, but at what cost?
Yeah.
You know,
That's a wrap for this episode of Vetted and Vetman. We hope you enjoyed today's conversation as much as we did.
we're all about keeping it real, sharing our stories, and creating space for women, especially Black women, in veterinary medicine to feel seen, heard, and supported.
If you love what you heard, don't forget to download our episodes, subscribe to the podcast, and leave us a review. It helps others find us.
And stay connected with us on social media. We're sharing behind the scenes moments, resources, and a whole lot of real talk. Follow us on Instagram and Facebook at Vetted and Vet Med and visit our website at vettedandvetmed.buzzsprout.com.
Plus, join our growing community on YouTube by subscribing to our channel. It's a space for deeper conversations, support, and all the good vibes.
Thanks for vibing with us. Until next time, take care of yourself and each other. You've been vetted and vet med.